we have gathered from students who have been sharing with us in the past. So we will run through them. And lastly, the most important and very interesting aspect, any question and answer that the students directly will be having, we will be going through that. So this is the flow of session that we thought today. And first and foremost, thank you so much, Dr. Nadeem, for accepting our request and coming and investing your time to talk to the students. So friends, I just want to have a quick introduction to Dr. Nadeem. So he is one very famous psychiatrist currently serving in one good hospital in UK, and they've also started a helpline kind of a thing where students who are in distress can take this opportunity to call to this helpline and discuss any emotional or mental health related challenges as well. So very humanitarian person, as I heard from Miss Natasha from Nirmaan. So thank you so much, and thank you for the wonderful work that you have been doing, Dr. Nadeem. So.
Thank you very much. I'm equally impressed by what I heard about Nirmaan doing. I think that is far more effective, and I'm sure that will bear fruit in the long run.
Yes, from a Nirmaan standpoint, so our commitment to this COVID-related wave 2 in India has been multifold. One is directly our teams are working very aggressively on the ground, contributing for various initiatives, right from setting up infrastructure in government hospitals to supporting rural district with some ICU beds and the home isolation kits. Apart from that, we are starting this series of webinars, one with doctors and with psychologists, so that any phobia around COVID, we want to take them off. At same point of time, make people very sensible and also, go with a campaign of stop the pandemic kind of a thing with right approach towards it and also the right mental approach towards it. So with that inspiration, we have started off this series of webinars. And students, for you all, see, the next one and a half hour of time, please be absolutely free to ask, or whatever you have, feel free, absolutely free to chat your messages out there. The whole idea is that each one of us should get amply benefited through this, and let's all fully be attentive. And one commitment from all of you, as you know, you should tell at least 5 things to 5 people. Whatever you learn today from Dr. Nadeem, you should tell it to at least 5 people in next 2 days of time. Everybody up for this challenge? Then that will be the true contribution or true reward that we can actually give back to Dr. Nadeem. So everybody ready for that? You should do it for 5 people, at least 5 tips that you learn from here today. Need more messages, more enthusiasm from all of you. Good to see a lot of messages coming. So thank you so much. Over to you, Dr. Nadeem. And please carry on, sir.
Thank you very much, Chandra. First of all, I would like to thank all of you for, especially Nirmaan, Geeta, and Chandra, for inviting me to talk to you all. What I want to talk about today is the COVID-19 and related mental health issues. So as a brief introduction was given, my full name is Dr. Zia Nadeem. I'm currently working as a consultant psychiatrist at St. John's Hospital in Scotland, which is a part of the United Kingdom. I'm also associated with what is known as MAHIR. It is an organization of doctors and IT people based in UK, basically, but with the sole aim of trying to do some good work for people back in Hyderabad. So we have various streams, medical. The most important thing that we have been doing in the past few weeks, because of the increasing number of COVID cases in Hyderabad, is to try and secure as many as possible oxygen concentrators and other medical equipment, which is being shipped to India, to Hyderabad, basically. There is a sister organization called Access Foundation, which runs a helpline, medical helpline. People can call the psychiatrist directly and other physicians and so on. So that is the brief introduction of my association. And through the Access and Mahir, I think it was Natasha ji who contacted us to present this talk to you. I want it to be a dialogue, which means that I'm not the only one who is going to speak all the time. I once I have given a brief introduction of, the various mental health issues, then I want the dialogue to start, which means, like, people who have played table tennis will know ping pong. So, you throw the ball to me, I throw it back to you. So question and answer session is very important as well. We'll see how many questions we can take. But later on also, through Chandra, through Geeta, I will be available to answer any questions. It is not that I'll just show my face today and then disappear. I'll be available for any queries and questions later on as well. Okay, so the only thing that we have heard from March 2020 onwards is nothing but COVID, COVID, COVID. I will not be surprised if, in a few months, people will start naming their children as COVID babies or COVID Kumar or COVID Ram or COVID Khan and whatnot, because we have heard about it so much. But the problem is, the more we hear about it, the more worried we get. And this is the basis of my talk that I'm going to talk to you about, is that while the scare is there, while the numbers are rising, but the anxiety, unfortunately, is far more increased than it should proportionally be. Okay, so going ahead, uh, right. Just a brief recap. You all have heard what is COVID-19, what happens if somebody is unfortunate to develop the coronavirus infection, high temperature, continuous and new cough, a loss or change to your sense of smell or taste. So that is the three things that are nowadays important that they say. Now, latest study shows that nearly 20% of COVID-19 positive patients developed a mental health issue like depression, anxiety, or dementia within 3 months of diagnosis. And another study also added PTSD. I'll tell you what PTSD is a little later. It is called post-traumatic stress disorder. Okay, so this is the basis of this, that there are people who have developed about 20%. That means if 5 people turn out to be COVID positive, one person will develop either anxiety or depression or dementia or PTSD within 3 months. So this is the scale of problem. But this is only about the people who have been diagnosed with COVID-19 as a positive case. What about people who do not have a diagnosis of COVID-19, people who are lucky not to have contracted the infection? Do you think that there are no anxiety problems in them? Do you think there are no depression problems in them? No, that's not true. Because although the risk of developing anxiety was increased in people who have COVID, but still, it's not that people without COVID did not have these problems. Now, this is a sample of a UK population. More than 2/3 of adults in the UK, which is about 69%, report feeling somewhat or very worried about the effect of COVID-19. Now, these are not the people who have contracted or who have got infected with COVID-19. These are the people who have not been infected with COVID-19. But about 69%, roughly 70% people say that they are feeling worried about it. And the most common issues affecting well-being are worry about their future, feeling stressed or anxious, and feeling bored, which is a common thing. Okay, so what is the average share of adults reporting symptoms of anxiety disorder? Now, this graph compares, this bar chart or this bar graph compares anxiety and depression cases before the COVID-19 started. See, we started talking about COVID-19 only in March or February, March 2020. But this one, the blue one, is about January to June 2019. So almost 1 year before the pandemic. About 11% people had anxiety. Fast forward to about 2 years, January 2021, 41% people are showing signs of anxiety disorder or depressive disorder. And these are not the people who have COVID positive or who had COVID positive at any point in their life. These are people who have not been COVID positive at all. Now, similarly, the age is also important. Which age it affects? As you can see in the first one, or during the pandemic, as I said, 41% have anxiety or depressive disorder. When you divide them into anxiety and depression separately, it's about 35% who are showing anxiety and about 28% who are showing depressive disorders. Right. What about the age then? 56% of the people who are in your age bracket, more than half of the people in your age bracket are showing signs of anxiety and depressive disorder. And that comes down as the age increases. So the second bar is 48%, and the adults between 50 and 64, which includes me in that group, is 39%. And then plus 65 comes down to 29%. So what I want to illustrate, what I want to tell you by showing this graph is, look, if you're feeling anxious, you're not alone. There are 56% like you in that age group of 18 to 24 who are feeling anxious. Okay. Now, what are the worries? What are the causes of these mental health issues worsening during the pandemic? What are the important issues? Why are you feeling anxious? Why are you feeling depressed? Some of the issues that have been gathered because of various studies are social isolation, because of the lockdown and other issues, schools being closed, colleges being closed, people working from home. You're not allowed to visit any relatives. Now, just now, we celebrated Eid just 3 days ago. And in Scotland, we are still having a tight lockdown. We could not meet families because the current guidelines are that only 4 people can meet inside the house. So we could not meet. This is the second Eid in a row Ramzan Eid in a row that we have celebrated. Likewise, many of you would have celebrated Diwali and Dasera and Ugadi, all that without meeting many people. That causes a social isolation. Then the most important thing is job and financial losses. The third important thing is housing insecurity and quality. People who are lucky to have maybe 2 3 bedroom, where one bedroom can be converted into a home office or working from home people. But what about people who live in a single room house, where they have to work from home in a corner while their young sister or brother is studying at the same time, and the mother is talking to her auntie on the phone, or the father is talking to his friends. All these things cause lots of anxiety as well. And then working in frontline professions like doctors, nurses, ambulance drivers, peons, helpers, attendants in the hospitals, and so on. These are also the people who have reported worsening mental health. And the most important thing is loss of coping mechanism. What is that coping mechanism? I'll tell you a little bit later. But this is a very important thing. And then reduced access to mental health services. You see, I mean, even in a country like Scotland or UK, where our mental health services are really good, we had to we had to cut down our services because some of our junior doctors were sent to medical ward. Some of our doctors were sent to COVID wards. So we had to reduce the mental health services. Because of that, what happened was access or availability of psychiatrists also reduced, causing further problems. Now, we talked about stress as the major factor, especially in your age group, about 58 to 60% people having the stress. But what is stress? Let us try to understand that a little bit. Actually, stress is a fact of life. Now, you, among the 50, 55 people sitting here today listening to me, raise your hand if you can confidently say, I don't have any stress. Or if you can say, I have never been stressed. Because if you do that, I'll tell you, you're telling a lie. Because that is just not possible that anybody can say, I don't have stress at all. Even children have stress. Even babies have stress. You will think, what stress will babies have? Now, if you have a very small child or baby in the house who wears nappies, what is the stress for them? Now, imagine this. The baby passes urine in the pamper gets wet, but the mother is busy cooking in the kitchen. The baby starts crying, but the mother does not have time to quickly come and change the pamper. So the baby's feeling awkward, feeling bad because that wet pamper is touching the baby. That is the stress for the baby. Baby feels hungry. Mother does not come and pick her up. That is a stress for the baby. Like that, nobody can say that they don't have stress in life. It is a fact of life. In fact, I say stress is life because I remember when I was doing my internship in Gandhi Hospital, we used to have a physician who uh, we used to go with him on rounds to see various patients. One day we were sitting with him in OPD, outpatient department. He was a medicine professor. A young man, about 20, 25, came and told him, Sir, I have chest pain. So he said, what chest pain in your age, man? Youngsters, they don't have chest pain and all. And then he joked, pain is a good thing in life because it is a sign of life. It means that you are alive. Dead bodies don't have pain. Okay, that was his style of joking at that time. But that is what I want to say about life and stress also. Dead bodies don't have any stress. It's only the living bodies, it's only you and me that have stress. And stress is a sign of life. And as I am going to say next, a little stress can be good, especially at the exam time. Until and unless you are stressed, you're not going to open your books and work hard. You're not going to, until the deadline is approaching, you're not going to open your books and study. So that stress is important. However, excessive stress can be very harmful. Now, I don't want to go into the clinical and chemical details of how stress develops. It is just to, it is because of the release of a chemical in the brain. That is how these things happen. So let's not go into the detail. But let's see what happens when you have stress. Some people don't realize stress. They come with, fatigue or sleeplessness or sweating or restlessness, but they can't say, Naku stress autundi ani. They can't come and tell you that they are feeling stressed. Excuse me, my Telugu is not very good. So if I make a grammatical mistake, you have to excuse me. So what are the signs of the stress? Increased heartbeat. Somebody can suddenly start feeling their heart racing. Tightened muscles, as if the whole body is somebody is holding you tight. Fatigue means you get tired after maybe doing some work for half an hour. You start feeling tired. You're sweeping your floor in the house or cleaning the floor or something. After 10 minutes you feel tired and you have to lie down. And sleeplessness or stomach or bowel upset. Sweating happens in anxiety again. Change in eating habits, that means either you don't feel like eating, you're feeling not at all hungry at all, or you eat a lot. We call it, comfort eating. And restlessness. You can't sit at still. You're moving around. You're constantly, going here and there, and that's how you are not at all restful. What are the symptoms here? Increase of heartbeat, aches and pains, frequent sickness, nausea, ante vantulu, an anxiety attack, and so on. Mental signs, those were the physical signs. Okay, what I told you were the physical signs. What are the mental signs of stress? Anxiety, forgetfulness. Young people will say, I'm not remembering what happened 2 days back or 3 days back. It's not because they are becoming old or they are having memory problems. It is only because of stress. Then they start feeling depressed, lack of interest. People, who like to watch IPL, they don't feel like watching any IPL. They don't feel like talking to the friends, and they don't like joking. They don't like, reading newspaper or anything. Increased anger and fear. Something is going to happen. I practiced in India for some time. In between working here, I came to Hyderabad for about 2 3 years, and I worked there. One of the common symptoms of anxiety, people used to come and say, "Sir, naku bhayam aitunda." Em bhayam andi? They won't be able to say what is the fear. They are just saying bhayam aitunda. There is no basis for the fear, but they are feeling frightened. Behavioral signs, hostility, irritability. Now, somebody says something, you snap back at him, or you reply him back, you give him a quick answer, or you shot him down or something, because you are stressed. It's not because that is your personality. People will say, oh, my personality has changed because I've become very irritable. Lack of concentration, memory problems, increase in smoking and drinking, and poor performance, whether it is work, whether it is studies, or whatever it is, that happens as poor performance again. Further problems, as I said, memory problems. difficulty making decisions. Even simple decisions like if you have 5 shirts in your house, in the morning you are standing and thinking which shirt I should wear today. That simple indecisiveness can also be resulting from stress, inability to concentrate, confusion. Most important thing is seeing only the negative. Everywhere, what you see is only negative. It is as if you have put on dark glasses. So everything becomes black, everything becomes gray, nothing, colorful at all in life. That is how the life becomes. Then repetitive or racing thoughts. ఇది ఎందుకు అవుతుంది అది ఎందుకు అవుతుంది why this is happening, why this is happening. Constantly you're thinking about the same thing. And poor judgment in the sense, sometimes you don't decide well. You spend money where you don't have to spend. You say something to friends you should not be saying, and things like that. And loss of objectivity. And the other important thing is desire to escape or run away. You feel like, oh, I want to leave everything and go away and sit in the jungle or go to the Himalayas and sit there. Sometimes you start feeling like that. So remember, as I said, because stress is a life sign of life, you cannot eliminate stress at all. What we have to learn and what we have to do is how you're going to manage it and use the same stress to help us and to become happy. How can we do that? You focus on the present. Don't worry about the past because what has happened has happened. You cannot get it back. You cannot, improve the past. Nothing at all. What has happened has happened. You focus on the present. What you have today. What happens to you? So,
Shiva or Prasad, possible to mute everyone else apart from Dr. Nadeem. Thank you.
Okay, thank you. So focus on the present. Affected 2 lakh people affected. Apart from increasing your anxiety, it is not going to help you. So, plus, look up at reputable sources. There are so many fake news that is happening nowadays. Somebody says something and it spreads like wildfire. Okay, that is something that you have to. Then make a personal financial plan. And again, try to stay connected. Like speak to somebody in the previous slide I told you. This is also another thing like that. Try to stay connected. Connected positively, not negatively. What happens nowadays is if you think you are connected to a friend, the only way you can show you're connected is you forward a WhatsApp message. That is not a sign of being connected. That anybody can do. Even a child, you teach him how to forward messages, he will do that. What is important is stay connected positively. If you don't hear from your friend in 2 days' time, you phone him, find out, are you all right? Why you did not come, or why did you not appear on the WhatsApp or whatever it is? But that is the way to stay connected. The other important thing is maintaining a routine and a proper structure. So because you are in the house, because you are in the lockdown, does not mean that you don't get up and don't brush your teeth, don't comb your hair, don't change your dress and just stay like that throughout the day. And your breakfast, which should be at 8 o'clock, you don't get up until 12 o'clock. Don't do that because that leads to a feeling of boredom and not feeling well and so on. So it is very important to see that you continue to maintain a routine and have a structure. Even if the school is closed or the college is closed, or if today there are no online classes, you have a structure. Okay, today, first hour, I will study physics, then I'll go for a walk, or I'll go and talk to my friend, or I'll go and help my people in the house, or whatever it is. Some structure you need to have, and you follow the same structure every day. Avoid too much, as I said, avoid too much TV and news. Nowadays, when you open the TV, you see nothing positive. Everything is negative, negative, negative. What is the point in filling your mind with all these negative news? So stop watching news too much. Resist, as I said, forwarding WhatsApp messages. Everybody is becoming a scientist nowadays on WhatsApp. Everybody will give explanation about COVID-19. Everybody will give suggestions for treatment from whatever it is. And then people think, oh, this is going to help my friend, and you forward. These are all, people who have too much time on their hands and have nothing else to do. They just gather all these messages and keep uh, passing on. You're not going to gain anything at all. ఒక్క మాత్రమే కూడా భయం beneficial. There is no uh, help at all by forwarding messages. Not even by 1%. You're not going to reduce the COVID-19 cases by forwarding all these WhatsApp messages. You're not going to treat people by sending all those WhatsApp messages. Stop that, please. Instead of that, develop new hobbies. Painting. I have seen so many people, what they have been doing, simple paintings they are doing, putting it up on, WhatsApp or something, selling them. Maybe 10 rupees, 50 rupees, 100 rupees, depending on how well you can draw. That is one way of getting some money also, keeping yourself busy, positively busy. You feel better. You develop a new hobby. So this is something that you need to do. Physical exercise. That is the most important thing. Nowadays, what people are talking about is in England, they say in UK, COVID flap. You may have seen one cartoon. They were in a room, one couple. Suddenly, they were like a balloon. They have grown fat. They are saying, okay, the COVID is over. We are all free now. We can go out. But how do we go out? Because we have grown so fat that we can't go out of this room from this door. That is also happening. What is? Because you're sitting in front of the TV all the time, sending messages all the time, no exercises, nothing. You're putting on weight unnecessarily. One problem after the other will start. Okay. Connect with nature. One of them can be yoga. So that is important thing that you need to keep in mind. Right. Where are we? Yeah. And the other important thing is help at home. Your poor mother is cooking 10 chapatis or 20 chapatis, and you're sitting on your sofa sending all those WhatsApp messages to everywhere in the world. Instead of that, stop that. Go and help your mother. She's washing the clothes from morning till evening. Go and help her out with that. I mean, these are simple things you can do that will make her happy, that will make you happy. And it's a very positive use of your time that you have. Okay. The other quick thing that you can do when suddenly you are faced with lots of anxiety, suddenly, you get a WhatsApp message that your uncle has expired because of COVID, or he has been taken into hospital, you start feeling panicky. What you can do is a deep breathing exercise. Once I remove the screen, I'll show you how to do that deep breathing exercise. Very simple exercise. All you need to do is to take a deep breath and hold it for some time and then leave it as much as possible. So when you're taking a deep breath, imagine you're, filling, there's a balloon inside your stomach and you're filling that balloon with that air. So imagine that, take as much air as possible and wait for some time. As if you're under the water, you're holding your breath. And then after that, you breathe out, push out all the air as if you're squeezing that balloon that is there in your stomach. Okay. So as you exhale, as you take out your breath, imagine all of your stress is flowing out of your body. And you will really see after practicing for 10 minutes that, you know, you even for 10, 15 minutes, you start feeling calm and relaxed. Okay, sleep and rest is important. Again, what is happening? Because tomorrow morning you don't have to get up at 7 o'clock to go to work or to college or anywhere. People are not in a hurry to go to sleep. People are staying up at 12 o'clock, 1 o'clock, 2 o'clock in the morning. Again, the same thing, watching news, WhatsApp messages, forwarding messages, receiving messages. No gain, nothing at all. Waste of time. Maintain a good sleeping pattern. Go to sleep at about 11, 12 o'clock. Get nice 8 hours of sleep. And once in a while, have a small nap during the night, during the lunchtime also. People in Japan, they call it a power nap, where they take a 20-minute after lunch, they just close their eyes and lie down for 20 minutes. It increases their energy, recharges them, relaxes them, and helps to wipe the brain of pressures and unpleasant feelings. The other important thing is you develop compassion. This is the most important thing I want to tell you during this. Look out for each other, your neighbor who may be ill, not able to go to the bazaar, not able to go to get some milk. Go and ask, Anna, emana kavale meeku? Find out, get them some milk if they ask you. Do something, show some compassion. I mean, even if you have 50 rupees in your pocket, 5 rupees charity you can give easily. That 45 rupees, because of the 5 rupees charity will you give to other people, those 45 rupees that are remaining in your pocket, I tell you, will have the power of 450 rupees. And that is the art of giving. So develop that. Don't say, I only have 10 rupees in my pocket. Give 1 rupee out of that. You will still have 9 rupees, but that will help someone who does not have even 1 paisa. The other important thing is gratitude. Gratitude, of course, to Almighty. In whatever form you pray to Almighty, because so far you're free of COVID. So far, you still have some money to eat, some food to eat. You have this free air to breathe. Luckily, you don't require ventilation. You don't require oxygen. You're breathing freely. And for that, you have to be thankful. Spend 10 minutes in the morning, 10 minutes in the afternoon, 10 minutes at night, thinking about how you can be helpful to people. And then afterwards, gratitude to your parents, to your teachers, to your friends, to your neighbors, because they are looking out after each other. That way, what will happen is all that negativity will turn into positivity. Just say thank you. Just say thank you. Just say thank you. 10 times you say thank you to 10 different people. They will feel happy. You will feel happy. So, the most important thing to remember is you cannot change your future, okay? But you can change your habits, and then the habits will definitely change your future. The other important thing to remember is you never know how strong you are until being strong is the only choice you have. Until you got to be strong. There's no other option apart from being strong. Then you will realize that how strong you are actually. Okay, at this point, I want to finish my presentation, and I want to thank you for your patient listening so far.
ఎందుకు ఇట్లా రొటేట్ అవుతుంది సిటీ?
Wonderful. Thank you, Dr. Nadeem, for the initial context setting and beautifully highlighting various signs that we need to see ourselves. It is very revealing, and it's like giving good perspective for me personally that 56% of students, 56% of people in our age, or at least in the student's age, and around 49%. That means almost every two people, one person is going through severe anxiety or this anxiety disorders, right? Friends, if you all see, right now we are around 63. That means more 64 we have. 32 of us here, 32 of us here are going through some anxiety related things. I am 100% sure not even 3 people or 5 people might have told someone else, right? నాకు ఈ ప్రాబ్లం అవుతుందని ఎంతమంది చెప్తున్నాము? చెప్తలేము కదా. I think let us open up, friends. Let us open up, and I will take this commitment. నేను మీకు చెప్పి నేను చేయకుండా ఉండను. I will start with me. I will also start opening up. I think that is a mind-blowing data point for me personally, that 50% of us, literally every two people, one of them is having this issue. So it is an important issue, friends, for all of us to take care of ourselves and also help others, right, when we are in this situation. So with that, Dr. Nadeem, we had run a questionnaire to our students, and some of them have a few common questions, which Shravani, Prasad, Bebishan, and few others have put it together. Shravani, would you like to start off with those common questions first, and then we can open up for the students as well?
Sure, sir. Thank you. So, hi, sir. Once again,
Hello,
hello, sir.
Yeah.
Once again, good afternoon. Sir, thank you so much for the wonderful presentation. So, sir, with this group of students, we had a personal conversation for about 5 to 6 minutes, and we have gathered some common questionnaire among all the students. So I'm presenting these questions in a one by one manner, sir. So the first question comes here. So I am facing sleeping disorder. So how can I overcome this, sir?
I think I have already touched briefly upon that.
Yeah.
What you're facing is not a sleeping disorder. What you're facing is a sleeping difficulty. There is a lot of difference between a disorder and a difficulty, because your sleeping problem just now is temporary. It is not a permanent problem. And once all these restrictions finish, all these issues finish, I'm sure your sleep will come back to normal. But what happens is, as I said, because of the habits that we develop, sometimes we feed our problems. We increase the problems by worrying about, oh, I'm not able to sleep well, I'm not able to sleep well. And then, sometimes you say, oh, because I'm not sleeping well, what is the point of going to bed at, say, 10 o'clock in the night or 11 o'clock in the night? As long as I'm not feeling sleepy, I'll sit and watch a movie or, YouTube or whatever. The blue light that is emitted from the TV or your phones disturbs your sleeping pattern as well, because sleeping is dependent on a chemical called melatonin. So it has to be produced in the blue light disturbs that production of melatonin. So that is an important message I want to give you. The one thing you need to do, don't watch half an hour before you go to bed any television program. Don't watch, don't go to bed with the phone in your hand and watching it until you fall asleep, because the blue light will disturb your sleep pattern. Put away your phone upside down so that, when there a message comes, the light comes up again on the phone, lights up the phone. That also disturbs the sleep pattern. Put the phone upside down. Go to bed at the same time. Whether you're falling asleep or not, that's a different thing. So suppose you develop a habit that 11 o'clock every night, 11 o'clock, you go to bed. No music, no sound, no mobile phone, no lights. Lie down. First night, you will be awake probably until 12 o'clock, 1 o'clock, 2 o'clock. Never mind. Keep lying in bed. Don't get up and go for a cigarette or for a cup of tea or a biscuit or whatever. Nothing. Just lie down. And, maybe start thinking of all the nice things, or, if you are religiously motivated, then you can start reciting the name of God Almighty, whatever it is. But do some activity in your brain quietly, not too exciting, not too, encourage. That way, you will. So today, you will sleep maybe after 3 hours. Go to bed next day again at 11 o'clock. Maybe you will fall asleep after 2.5 hours. Next day, go to bed again at 11 o'clock. Maybe you will go to sleep at 1 o'clock. Like that, if you maintain the, because in the brain, there is something called a biological clock. It is a number of cells, brain cells that are present there. You have to train that. You have to train that biological clock. So the body will send signal. It is sleeping time now. So you have to send a signal through these biological clock that it is a sleeping time. That's how you will start falling asleep. Now, if you really have, with all these things also, you're not able to sleep up to 3 o'clock, 4 o'clock in the morning or something, then the other thing I tell you, don't take any tea after 6, 7 o'clock in the evening. No coffee, no tea, no cool drinks like Pepsi or aerated drinks. Maybe have a cup of hot milk before you go to bed. Or if there are facilities, if there is enough water in the house, have a shower before you go to bed. All these things will relax your body and you will be able to. If all this doesn't work, then consult a doctor. A small tablet might help initially. But the first things first, and then this is the last thing. Okay, next.
Yeah, thank you, sir. And the next question comes like, always I'm in a mood of worrying about my studies and unknowingly worrying for everything that I come across. So how can I limit my thoughts, sir?
I think hopefully I have answered that question through the lecture that I presented. If you work on those points that we discussed, I'm sure some of the, as I said, it is like a tiger. You have to tame that tiger. Anxiety is like a tiger. You have to tame the tiger. It's not going to happen today. After this lecture, I'm not saying everybody will start feeling perfectly stress-free and go back home happily. It's not going to happen. It's going to take time. You got to train yourself. Practice Jayala. Practice just your anxiety will improve. Okay.
Thank you, sir. And the next question is, my parents' drinking and smoking habits or their fights in the family is making me cry and sometimes I feel hopeless. So how can I solve this?
Unfortunately, this is a very common problem in a lot of families, especially in the villages and all that, because unfortunately the alcohol is available, the cheap alcohol is available very freely and all that. This is a serious problem. I mean, I don't have a 1 minute answer to that, because what you need to do, your first role maybe, try to talk separately to your daddy at one time, to your mommy at one time. Tell them, Amma, you're fighting with Papa is causing problems to us. It will cause problems to you also. Why do you do that? Then your mother will say her own problems to you, maybe. Father will say his own problems to you, maybe, because they may not have anybody else to talk to. So you become their psychologist, you become their counselor. when your papa is out in the fields or has gone out to visit a friend, sit down with your mother and say, Amma, enduku idi kotlada pitlada aitadamma. This is having effect on me kada, on all the children, on your health also. That way, you approach them. And who knows, that might work. If it doesn't, then you can ask someone, an elderly in your family, to intervene and suggest to them that you got to talk to them, because these people are fighting all the time, they are causing lots of problems. Sometimes the problems, if the alcohol is becoming a really problematic issue, then I think you must go and talk to a doctor also about it.
Thank you, sir, for that. And the next question is like, sir, I'm not able to focus on one particular thing for a long period of time. I'm getting distracted very easily. So, sir, what might be the reasons and how can I overcome this?
You see, there can be a simple problem like stress, and you're not unduly worried about whatever you are studying about, or there are pressures in the house, there are financial pressures, there are social pressures. Plus, if it is a big problem, it can be, anxiety or depression. So I think the best thing would be to talk to a doctor, or maybe, through Geeta and Chandra, contact me later on, and then we can have a one-to-one session to discuss that more closely.
Okay, thank you, sir. And the next question is like, online classes and busy schedules with the academics brings a lot of stress. How can I cope up with that? Or there any some kind of tips for that, sir?
Sorry. Prioritization. That is probably the most important thing. Sometimes, online classes, the teachers and the lecturers, sometimes they make you do things that may not be that important, but because, they have to keep you busy, they'll give you some work. So you have to prioritize what is the most important thing that I have to finish today because the exam is tomorrow, or I have an assignment I have to submit in 1 week time. So you do that first. The other things, if they are not very important, they can wait for some time. But of course, you have to work. And, the one thing that you have to remember is online classes are still better than, going to college and studying. How much time you spend in your traveling? If you're taking a bus, half an hour, 1 hour in the morning, half an hour, 1 hour to come back, and the buses are not available in time, means you are wasting more time. All that time is available to you during the online classes. Just because, you are not having a proper structure and routine, that's why maybe you are not approaching it properly. But if you, like, online classes means, what I have heard nowadays is, because they are recorded, you don't start attending college or classes at 9 o'clock sharp. You start at 10 o'clock, you start at 11 o'clock. That way, everything keeps falling behind. Stick to the time. As if your college bell is at 9 o'clock, you get up, be ready after breakfast at 9 o'clock. That way you can manage. And as I said, yeah, time management and prioritization, these are very important things that you have to learn by practice. Thank you.
Thank you, sir. And the next question is like, sir, how to get rid of addictions like gaming, social media surfing, etc.?
I wish I had a very easy answer to that. All of us in one way are addicted to something or the other. Again, the problem is it a positive addiction? Is it a negative addiction? Positive addiction, what can it be? Are you gaining something positive out of it? Are you helping out other people? Like, my wife gets angry that I'm on phone all the time, on messages all the time. But more than half the time, we are trying to, deal with stuff, dealing with the charity. We are sending messages to organize, a bed in the hospital in Hyderabad, and things like that. So that way is different. But if you're just watching YouTube videos or all the, You see, WhatsApp messages, not 90, about 40% will contain a video sent by your friend, but not made by that friend. It's made by someone in Patiala. It's coming to you in Bhongir. So you are sitting in Bhongir, you are watching a video made in Patiala, Punjab. What is the point? What is the purpose of that? So you have to decide what is important. You cannot totally get rid of phone and things like that nowadays, because these are also important way of being connected with people. But important is, again, what I told about studies, the same thing I'll use here. Prioritization is important. See what is important. If you open my WhatsApp now, you will see 90% of videos, they just go into the junk straight away. I don't even watch them, because I know if it is important, the person sending will say something. This is an important video, please watch it, or something like that. Otherwise, just a senseless forward, and you're wasting 3 minutes and watching a video, made somewhere in uh, Thailand or Australia. What is the fun of it for you? So that is the important thing. That way, because you like it, you have to spend time, you laugh, you keep watching it. It is called reinforcement. Cut that reinforcement ring. You say, no, I don't want to watch all the unnecessary videos. Just one day you practice, for half a day you practice that. You will see how much time you're saving. And that way you can slowly control your addiction. Thank you.
Shravani, at this point, I have a question. Nadeem sir, it is self-disclosure. When I was going through my cycle of anxiety and sudden bouts of anxiety, doing a lot of breathing could not help me. But when I was looking at some stand-up comedy or something that was making me laugh like crazy, that worked for me. So as a Ritzi, I'm able to see that a lot of people are actually identifying with this. So this, I fell into a cycle of just watching the stand-up comedy. So it has now become a routine for me because I'm feeling very nice and I'm able to come out of anxiety. So now how do you differentiate that, whether it's a positive addiction, negative addiction, or how do we go about it?
I mean, you see, again, it's a matter of prioritization. I mean, if you have to do your work, you have to do your studies, are you still wanting to be happy and laughing at Kunal Kamra's comedy, or whoever it is, Varun Grovel's comedy or something? Importance is what is okay. You're feeling sad just now because your health has not been good, or you heard a bad news. For some time, 1 hour, you watch a comedy. Okay, you feel fine about it. But after that, okay, I'm feeling fine now. Let me get on my work. Immediately shift the focus. It should not go on in a loop, like one video, because the YouTube, this is the thing. If you watch that movie called Social Network, you will understand how they play with your minds. YouTube, because you liked one video, suddenly it will send you 10 suggestions that this also you. So they are helping you become addicted. But if you say, okay, I'm feeling bad, let me spend 10 minutes watching this video, and that's it. After 10 minutes, maybe this is the best comedy in the world also. That's enough. I'll watch it after 2 hours. Let me get on to my immediate work. So postponing some of the things are important, very important.
Thank
Yeah,
you, sir.
next.
I think that
Thank
answered
you.
for me. Thank you.
You're welcome. Yeah.
So the next question comes here. So, sir, I have a feeling that a natural fear of death, losing someone close to me, and always feeling sick, these kind of moods. So, how can I overcome this, sir?
Again, as I said, I think this is a very important question, but hopefully I would have done some justice by answering that, how to do that. As I said, focus on the present. Worrying about the future is not going to help you. Nowadays, the one thing you have to remember, everybody is worried about this COVID thing. What if it, and when it happens, it makes no difference whether you are a millionaire or whether you are a poor person. Even millionaires are not able to get an ICU bed. Even millionaires are not going to get their remdesivir injection. Even millionaires are not able to get their vaccination. So, I mean, this is a worry which is for the present. Hopefully, everything will pass soon and then it will not be that bad. But try to focus. Okay, what is happening now? Okay, my uncle is not well. What can I do? I cannot go and visit my uncle. I'll phone my cousin. I'll keep him busy. I'll keep him happy. I'll ask him to, watch a film together on the video or something like that. Some way of helping that you are helping your uncle. That way your mind is diverted, your cousin's mind is diverted, the family's mind is diverted also. And hopefully, the other tips you may have picked up from my lecture will help you. Thank you.
Thank you, sir. And the one question is like, I'm getting long lasting sadness and irritability and sometimes extremely high and low moods. So how can I overcome this, sir?
You see, we do have to differentiate between whether it is minimal anxiety or it is an anxiety disorder or normal depression that every one of us are going through, as I said, more than 56% people are going through that, or whether it is an illness. So for that, probably, if it is identified that it is some form of an illness, then you may need treatment. So maybe talk to a doctor or talk to a psychologist and consult them.
Yes. Thank you, sir. And the next question is like, I'm getting distracted with movies, relationships, thoughts, comparisons with my friends, etc. So how can I control my thoughts?
Again, because these were the questions that were prepared before the lecture. Hopefully,
Yes.
Some of the tips again will help from what I have said. So if you have paid attention, or you can go back to the record.
So how do we?
I mean, this is actually a legal problem. It's a big problem. I mean, even in the UK, we have seen that there is a lot of domestic abuse that is happening, because you see, the people would go away for the whole day and away from the home from morning till evening, and when they come back, there will be only 1 or 2 hours, 3 hours of exposure, which they will somehow manage. But nowadays, what is happening is they're being 24 hours together. The friction is increasing. So, I mean, if there are really difficult situations and conditions of social, physical abuse and harassment and all that, I think proper legal channels should be resorted to, proper help. Yeah.
Sir, one last question. We as responsible citizens, what can we do for mental health? What can we do during this time of pandemic or otherwise also? What is our role to fight any kind of mental illness?
During this Eid, I must have made some 50, 60 phone calls and video calls to people. The first question I asked after I told them Eid Mubarak was, did you get your vaccine? So that is your social responsibility, to debunk the myth, to not to worry about these things that vaccine is causing clotting and all that. COVID is causing clotting far more than the vaccine will cause. Okay. So tell your people, of course, youngsters, you are probably not going to get it so soon, but tell your elders, wherever it is possible, vaccine is a definite way of keeping the COVID under control. And again, from a third wave appearing or whatever it is. So your social responsibility is every elderly person you meet, ask them, remind them, Baba, go and take the vaccine. About mental health, again, approach them. Like I said earlier, ఏమండి ఎందుకు ఎంత గుమ్మనుగా ఉన్నావు, ఏమైనా ప్రాబ్లం ఉంటే నాకు చెప్పండి. I'm not a psychiatrist, but at least hearing you will help. It will help you talking. See, what I say is why psychotherapy has been developed by Sigmund Freud and all that. If you have a boil on the hand with a lot of pus inside, okay, what you do, what the surgeon does is it cuts it and lets the pus flow out of the body. That process is painful initially, but once the pus comes out, you feel relief. Psychological problems and psychotherapy is also like that. So much problems, bottled up inside. You need a way for all that pus to come out. So you need to talk to people. And you need not talk only to psychologists. Simple. Chapandi, how was your day? What are you feeling bad about? So no, my father is having problems. He drinks a lot. He's doing this. And even that expression will reduce his pressure. So that is another social responsibility. You approach your friends, talk to them, tell them, Baba, if you have any problem, please, I'll be confident in me. I'm not going to share it with other people. Your secret is my secret, but you tell me. You talk to me. That is the important thing. I think that is the biggest social responsibility that I want to give you all today, is that look out for each other, hold each other's hands, be compassionate, as I said in my last slide. And that is a sign of showing compassion, by looking out for each other.
Thank you so much,
Okay?
Nadeem, sir.
Yeah.
Thank you.
My pleasure. My
Sir,
pleasure.
yeah, so one last request, sir. Can you please explain about us the loss of coping mechanism?
As I said, different people have different coping mechanisms. Some people, take up a hobby. Some people take up walking. Some people take up jogging. Some people take up some extra work. Some people, start sitting down and realizing what the main problems are and how to overcome that, and then develop strategies to do that. So coping mechanisms can be different for different people. I mean, there can be no, standard set of rules, regulations to develop coping mechanisms. Everybody's coping mechanisms will be different. Some people cry and let out their problems. That is their coping mechanism. Somebody, goes and cries in the bathroom. That is their coping mechanism. Somebody tells a friend, shares the problem with a friend, that is their coping. Somebody writes a diary and write all the problem in them, that is their coping mechanism. So everybody will have different coping mechanisms. Okay.
Thank you, sir.
Wonderful.
Yeah. Go
yeah,
ahead.
Dr. Nadeem, if you want to share any concluding points.
Nothing at all. I was very impressed by the amount of pre-lecture questions that had come up, and also the constant questions that have been coming up, which shows the encouragement that you did, Chandra, asking people to. But most important thing, what I liked about what you said was each one, tell 5 people about this. If nothing else, just tell 5 people about, if you have any problem, Baba, share it with me. That is the most important thing. Okay. And it was a lovely opportunity. I loved every moment of it. Thank you very much, all of you.
Dr. Nadeem, honestly, to say your voice was very soothing and it was healing during the process you were talking. I want to be very honest, because as somebody who has gone through anxiety, every word that you were saying, I was able to identify myself with it. And some of the coping techniques I already put into practice and they've already started to show results. I think the others also should go into my routine now. But it was very, very informative. You laid emphasis on where it must, and it was definitely a very enriching experience for all of us with a non-psychology background to understand not an apparent thing which is not in front of our eyes, but it's there.
Exactly.
So that kind of a thing, it was honestly, it was very overwhelming at one point of time when I was hearing you. Thank you so much for being there for us.
Thank you very much. It was my pleasure. Thank you for liking that. Thank you.
Yeah, I think for us to make this happen, it was just a few WhatsApp messages which has made this happen. And I definitely want to acknowledge Natasha ji's,
oh yeah, she's there now. I can see her,
happen.
Natasha, madam. Thank you.
Natasha
Definitely.
ma'am, if you want to quickly share a couple of words. And I'm sure, we'll have more avenues where you'll be talking to all other students of Career Saathi program as well.
I would love to.
I just have to say it just came out. It was just meant to happen. I was telling Dr. Umer about how some of our kids are really struggling, and he said, "I know exactly the right person." And it just and I said, let me just check if we can make it happen. Does everyone really understand English? What is the level of communication that will be possible in a Zoom call? But even before I could ask Chandra, he told me, my friend, I've already spoken to him and he's already agreed. So you just have to make it happen somehow. So thank you so much, Dr. Nadeem.
My pleasure entirely. Thank you.
And I will echo Geeta. It was not just for students. I know you were talking to the students, but even to me as a mother of teenagers myself, I was relating to the whole thing because I think all of us are struggling in our own ways, and this would help us help ourselves and help others. So thank you very much for taking the time out, and I'm sure everyone's really benefited from it.
Thank you so much. It was a pleasure, as I said, and I would love to join you all again whenever you call me back.
Oh, wonderful. Sir, just to make it a little more action-oriented as well, sorry to take a little longer. Friends, we'll close it in another 4 to 5 minutes of time. Because I want this very productive session to actually being implemented as well. So all CSP students, as I told you, we will have each one of us should at least talk about 5 things that you have learned from here, 5 top things which will help you personally, right? So each one of us, for one of us, I could get really connected with this routine. So Dr. Nadeem was stressing so much about routine and prioritization, right? So now we are just getting, I'm flooded with so many other works also. Sometimes it's getting very messier for me also, and I'm not able to organize it really well. So that I could really connect very well. That could probably be causing a bit of stress in me as well. So 5 things that I thought about. One is about the, first, very alarming, 56% of people in your age group and about 50%, which is showing I am not alone. If I am having stress, there are many people, every alternate person is there. That is one takeaway that I am currently having. And the second thing is very important, I felt, is talk to the people you trust. And the question also I asked, if somebody is making fun of me, what do I do? They are not the real people for us, is what Dr. Nadeem has told. So at least in this process, I'll get people whom I can fully trust. There is much longer life than 1 or 2 instances, right? So today, negative వచ్చింది, no problem. Manak life chaana pedda undi inka. So at least you will know whom you can really trust. This is number 2, which I feel, because I'm trying to be very open. I want to fight it out by myself. That spirit I usually have a lot in me. No matter whatever problem is in this world, I want to fight it by myself. But I think from there, I want to shift my mindset of, I will take the support of people and make it even better and bigger world, even brighter world. So that mindset I'm slightly trying to change. So number 2 is talk to the people whom I trust. Number 3, routine and structure. Every day I want to commit myself that I'll come up with my routine and structure very clearly, right? Number 4 is about physical exercise, which Sir was talking about. Physical exercise is something which I will take every day. Every day I will ensure that I will sweat. Right? Some sweat should trickle from the body. That level of intensity we should definitely have is what I felt. And lastly, developing a new hobby, at least one new hobby where you'll become a little more joyful or do something else, right? So friends, I am telling all this why, because I want each one of you to do, and each one of you should become a champion to spread it to more.
Yeah.
Sir, I guess there is a network issue at Chandra sir's end.
Chandra's house, yeah, okay.
Yeah. Just I'll inquire about it, sir. Just a couple of minutes.
Yeah.
Okay.
Just he resigned. Just wait him. Keith and Chandra both will resign just now.
Sorry, there was a sudden power off at my end, and can you hear me now?
Yes, yeah, we can.
Okay, so there is a sudden power cut, and I had to shift to mobile. So, friends, these are the 5 things that I have taken it for me personally. There are several other points also which I have noted down. So, the thing for each one of us is, as you yesterday also we had one session with the day before with the one doctor. So, to at least 5 people and our learnings, can we make it as a poster? Right? Can we make it as a nice poster of whatever learnings that you have? And I also actually want to run it as a competition across all 3 centers of Telangana, AP and Karnataka. For all of you who ever have been part of it, you will also be given, we will give some nice awards for 1, 2 and 3. This will your posters, Dr. Nadeem, if I can ask you, we will select from out of 50 or 60 or that we will get, we will select you top 5 or 6. If you can select top 3 out of them, and we will give some good direct financial support benefit. First prize.
There seems to be another network issue with Chandrasekhar, but I wanted to add that I would like to give the prizes from my end, please. Whatever you all
That's
decide.
so generous of you, sir.
Yeah.
That's so generous. I mean, so appreciate your gesture.
It will be my pleasure, and it will show the level of enthusiasm the people have shown. So you all decide, and the award will be from me.
Great for this. Thank you so much. Sure. Chandra, are you able to connect?
Yeah. Did I don't know till where they heard.
Yeah, but I think you missed out a very important point, that instead of Nirmaan giving away the award prizes, Dr. Nadeem wants to give it to our children.
Oh my God.
So,
Okay.
Yeah, that's what you missed.
Just gratitude flowing out, Dr. Nadeem. Thank you so much for that.
My pleasure. It's whatever I can do. Thank you.
See, it's usually when we invite speaker, we should be paying it for the speaker.
Oh no.
It's the other way that is happening.
You have paid with your time and energy. That's enough.
Oh, wonderful. Friends, at least for the gratitude that we should show to Dr. Nadeem, each one of us, let us put our best foot forward. Every alternate person is affected with this. Let us be those champions of change, right? So with that, I hope all of you will be doing that. And let us also attach a timeline for that. 3 days from now, 19th end of day tak, everybody should be sending off your posters as well, and the 5 people whom you mentioned as well, right? Yeah. Okay, wonderful. Thank you so much, Dr. Nadeem.
Thank you very much.
Again,
I loved being here. Thank you a lot. Okay.
Thank you
Thanks
so much,
everyone.
sir.
Thank you.
Thank
you.
Thank you.
Thank you. Bye.
Thank you.
Thank you, sir.
Bye.
Thank you so much.